1977, a researcher proposed to NIH in a research proposal to study the possibility of using in vitro fertilization as an infertility treatment. There were regulations at the time that said that the Department of Health, Education, and Welfare, as it was called then, could only approve such a study if an ethics advisory board reviewed and approved it before it began. So early in 1978, Secretary of Health, Education, and Welfare, Joseph Califano, appointed an ethics advisory board. James Gaither was the chair. Richard McCormick and Cecil Bach were two bioethicists. On the panel, Charles McCarthy and Barbara Mishkin, two very good friends, were the principal staff people for the Ethics Advisory Board. In the spring of '78, the proposal by the researcher to do in vitro fertilization research was brought to the Ethics Advisory Board, and the board agreed to review it. Little could the board know that in the summer of 1978, Louise Brown would be born on July 25th. And so this issue that looked fairly abstract, an NIH research proposal, suddenly was in the public eye. So the Ethics Advisory Board had a context in which to do its work. The board worked very hard. John Biggers, a reproductive biologist at Harvard, conducted a worldwide survey of the literature on the field. He looked into what is the usual rate of loss in humans after fertilization occurs, and concluded that perhaps a third of all early embryos are lost sometimes before a woman knows that she's pregnant or could be tested for pregnancy, sometimes later on. But there was research, and then research on what had been done in non-human species on in vitro fertilization. By May 4th of 1979, the Ethics Advisory Board had completed its work. It agreed that research on early embryos not needed for reproduction, so leftover embryos, could be used in research, that it was not ethically unacceptable to do such research. And they also concluded that in carefully controlled circumstances, clinical in vitro fertilization could be offered to patients. The report went into Secretary Califano on May 4th, 1979. Unfortunately, there was some kind of disagreement between Secretary Califano and President Jimmy Carter before Secretary Califano could respond to the report. And no Secretary of Health, Education, and Welfare ever responded to the Ethics Advisory Board report. It was a beautiful, well-documented report, and it just gathered dust on shelves. And it wasn't until the mid-1980s that the Warnock Committee in the United Kingdom produced its own report on human in vitro fertilization and embryo transfer, and got worldwide recognition for the beautiful report that they wrote and the analysis that they did. The Warnock Committee report is an excellent document, but this is a case where we had an excellent report in 1979, but the public policymakers were not ready to deal with the issue, and so they failed to confront it between 1979 and the mid-1980s. So it was discouraging to have done such hard work to produce a good report and then not have it become an integral part of public policy in the United States.